Okay, so the proper way of opening a gown is to take it from the top and then shake it down. What should a healthcare professional consider to select the most appropriate type of gown? They should probably like consider the setting they're in. Like you'll probably need like a different type of gown, like depending on like what you're dealing with, like whether you think like there'll be more blood on it or like what kinds of materials like might touch the gown. 4 reasons gloves should be replaced. Because like you can contaminate the area. And then like if something gets on the gloves, then like if something gets on the gloves, you could touch something else. They should be replaced in case you touch germs on the patient. And then because the material can probably wear out over time. 2 different types of gowns. The first is the PPE gown, and I guess that would be used when you're dealing with like an emergency. And then another type of gown is a surgical gown, and that would be used in surgery. Okay, 3 steps in order for applying a mask. So first, you have to grab it from the top and then put it over your nose and then do the top strap first and then tie the bottom strap. What are enteric precautions? I think these are precautions for who can enter the hospital. The correct order of removing the PPE is first you want to untie the top, and then second you want to untie the bottom strap, and then you want to like shake it out and try not to touch the outside part with your hands. The proper way of picking up a mask is to grab it from the strap so you're not touching the inside. To be effective, a PPE must be thrown away or put on according to procedure because things could probably contaminate the PPE. So then it should be put on initially or else it won't be able to be used anymore. Goggles are most reliable and practical eye protection for 3 elements. Probably blood, air, and other bodily fluids. The steps of doffing a contaminated gown. You want to untie the top string, untie the bottom string, and then shake it down and make sure to like fold it inside of itself. So like you're not touching the contaminated part. Airborne precautions have to deal with particles that come from the air, like what a patient would breathe out. Um, Contact precautions have to deal with um, substances you could come in contact with, and droplet precautions have to deal with like liquids, like for example, sneezing. One difference in the required PPE that should be worn when caring for patients with each of these types of precautions. Um, I think that for all of them, you should be wearing gloves. Differences, and then wear a mask for all of them. I'm guessing that for contact precautions and that you don't need to wear goggles.